This is a commentary on our editorial on preventing heart failure, sweetened beverages, and healthy lifestyle by Miguel Martínez-González and Miguel Ruiz-Canela from the University of Navarra in Spain. Sweetened beverages were associated with a higher risk of heart failure in a Swedish cohort in the paper published by Rahman I in Heart 2015. They followed up more than 42,000 men from 45 to 70 years of age during an average time of 12 years. During the follow-up time, they observed more than 4,000 cases of heart failure. They found that the multivariable adjusted hazard ratio associated with consuming 2 or more servings of sweetened beverages versus non-consumers was 1.23, with a 95% confidence interval of 1.12 to 1.35. Heart failure represents a global public health crisis, and in the UK, there are more than 300,000 men and 250,000 of women living with heart failure, and their survival estimates are 50% after 5 years and only 10% after 10 years. Sugar-sweetened beverages represent a harmful impact on global health. They are responsible for more than 180,000 deaths globally. 5% of all diabetes-related deaths are attributed to sugar-sweetened beverages, and 0.5% of all deaths related to increased adiposity. Also, they contribute greatly to the disability-adjusted life of years according to the estimates of the global burden of disease. They are responsible of 49.5% of disability-adjusted life years attributed to sugar-sweetened beverages are due to cardiovascular disease, and 41.4% attributed to diabetes. So the assessment of the modifiable risk factors associated with heart failure requires a more comprehensive approach, because it is not only a question of looking at total cholesterol, blood pressure, or fasting glucose, but to look also to at more distal determinants such as diet, alcohol consumption, physical activity, or smoking. In this context, sweetened beverages represent a modifiable lifestyle factor associated with a poor diet. Several previous studies have reported this very impressive reduction in the risk of heart failure associated with a combination of factors, including non-smoking, healthy diet, physical activity, reduced adiposity. All of them combined provide a score of a healthy lifestyle. So, in the comparison between the best and the worst values of the score, reduction very important with relative risk of 0.19, 0.55, 0.30, 0.19, or 0.23 in these studies have been reported. So in conclusion, the study by Rahman et is very relevant. Sweetened beverages indeed have an impact on cardiovascular disease, and they are associated with poor quality diet, and the best advice in clinical practice will be to consume water to reduce or eliminate the consumption of sugar beverages. Thank you very much.